Welcome to the first ever International Homeopathic Webinar on COVID-like illness. Today, the experts will discuss the advanced repertorization tools and strategies for effective prescribing. We invite Dr. S.K. Mishra, Principal and CEO of state-owned Homeopathic Medical College and Hospital in Bhopal, India, the organizer of today's event for his inaugural address.
International webinar COVID-like illness, infectional disease. Homeopathic role is very effective, especially prophylactic. Government of India suggested arsenic 30 is also preventive drug, and so many other drugs as per symptoms. Seminars, seminar, webinar, success, Nambison, Nambison, and team. I wish all the best. Thank you.
Thank you, sir. Please, let us now start off the webinar. At the outset, please welcome Professor Dr. Nambison, the convener to start the event. Dr. Nambison, MD has authored several research papers in national and international peer-reviewed journals. He has authored several books, including the exhaustive translation of complete Repertory in Hindi language, along with his wife Dr. Nambison. As a medical scientist, he has 4 patents to his credit too. Presently, Associate Professor and Nodal Officer for the world's largest homeopathic study of $500,000. Over to you, Professor Nambison.
Hi friends, welcome to this first international homeopathic webinar on COVID-like illness, where we want to talk about the different strategies and tools that can be used in cracking these difficult cases, not only for COVID-like illness but also for different challenging cases that you encounter in your clinics. We are not going to talk about the regular repertorization techniques that are being taught in your institutional trainings, but we are here to talk about some advanced techniques of repertorization. And in this field we have 2 pioneers, and they are today our guests, and they will teach you the advanced techniques, and I will also talk about some advanced techniques of repertorization and how to crack these difficult cases. So the 2 distinguished guests today have done a wonderful job in their respective areas, and they are pioneers in their field, have contributed immensely to homeopathy, and I would like to introduce both of them to you. I have the honor of being friends to both of them. One is pioneer in the field of repertory, and on some point of time I am sure you must have used complete repertory, and the author of complete repertory, Roger van Zandvoort, is our speaker today, and he has very closely worked with Dr.Eduard van Grinsven, who also is from Netherlands, and both of them together built a very unique software, Complete Dynamics, which is immensely popular and one of the most used homeopathic software in the world. So I welcome both of you, Dr. Roger, Dr. Eduard.
Dr. Roger van Zandvoort. is from Netherlands, but presently in Thailand. Roger has dedicated his whole life to creating the best homeopathic repertory in the world. Complete Repertory, by Roger van Zandvoort, is the world's leading homeopathic repertory, and is used by almost all homeopaths. Roger is the author of the Complete Repertory, and Repertorium Universale, published in several languages. He lectures, and continues writing, developing, for the benefit of homeopathy. His work is used by nearly all the important homeopathic softwares worldwide. You can discuss about his work on his Facebook page.
Good evening, people. I hope you are going to have a very nice seminar with Nisanth and people about the use of the repertory and repertorization, and perhaps especially how to use the crossings. I'm looking forward to the video. I wish Nisanth and you all a very successful webinar. Take care.
Dr.Eduard van Grinsven is from Netherlands. Homeopath, CEO and Chief Architect of the world's #1 homeopathic software Complete Dynamics. Dr.Eduard has a professional background in software development of over 30 years. He has run a private practice in homeopathy since 1998.
Dear colleagues and friends, my name is Eduard van Grinsven. I'm CEO and Chief Architect of Complete Dynamics software for homeopathic professionals. I'm locked up here in the French countryside, where we still have travel restrictions and lots of many other restrictions caused by the coronavirus pandemic. I welcome this initiative to do internet-based training. I know homeopathy can do a lot for situations like this. Likewise, Complete Dynamics software can do a lot to help the homeopathic doctors. I wish you lots of success, and I hope you get the most out of this internet-based training. See you.
So, let us now start the much-awaited webinar course. Any case repertorization needs the basic understanding of the construction and strategies of repertory. So to understand the concept, let us learn from the author himself, and so our first expert, Dr. Roger, will today discuss about building blocks of repertory. Over to you, Roger.
Good evening, people. We are going to use this video to talk a little bit more about building blocks. Building blocks are used by everybody, but probably not always very consciously. And with this video, I will try to change your knowledge about building blocks a bit and show you what the consciousness, what the knowledge of these building blocks can help you with. The building blocks that we probably know are the ones that we often call, for example, sensations as if. That's called subjective phenomenon, and phenomena are building blocks as used in the repertory, as are modalities, another example, as are locations. And in Complete Dynamics, we have made it very easy for you to work with these building blocks. If we go, let's see, to head, then we see the beginning of the head chapter. We will not show the remedies, which is something that you do by first clicking in the book and then just click the space bar and your remedies are gone, and you will only see the rubrics and references and cross-references. Now, there is a filter in the top of your window that normally on default shows all remedies, and another one here that shows all rubrics. And this one is the one we are going to use now. Instead of showing all rubrics, you can choose to show only one specific building block. So those building blocks are alternating rubrics, the sites, left, right, etc. Times, time modalities. Extending to, another set of building blocks. Locations, with which we normally mean not the chapters themselves, but more specific rubrics called locations within the section, within the chapters. Then there is the building block modalities, well known in general. And the last one, also well known, phenomena. Let's see what happens if we choose phenomena for the head section. What you get then are only the rubrics that are labeled as phenomena visible. So now you have a good example of phenomena in the head, like abscess. Abscess is an objective phenomenon, can be observed by the practitioner. The subjective phenomenon, like this one, is something that is a phenomenon but can only be observed by the patient because it's a sensation. I think that makes it clear. We can do the same for the mind section, where you find many phenomena. Rubric general, psychological themes, abhorrence, ability increased. This is actually wrong, shouldn't be there. I will need to correct that. It's obviously labeled as a phenomenon, but it is a modality. Absences, absent-mindedness, absorbed, buried in thought, etc. We show you another set. Instead of phenomena, we will choose modalities. So since the modalities are often sub-rubrics of phenomena, to keep you have a good idea about where you are in the repertory, we also show the leading phenomenon, and then we follow the modalities as sub-rubrics under that. Coffee after is a modality of absent-mindedness. Anxiety with, apoplexia in, children in, etc. We will do the same again for the head section. Head, external, air aggravates cold air, aggravates open air. And we show you another set, the time modalities, morning, forenoon, afternoon, evening, night, etc. And we show you some that are less known. The alternating symptoms, alternating states, bold sensation, alternating with stitching in forehead, coldness, alternating with congestion. These are important and should be differed from modalities. In Ken's repertory, the alternating symptoms are residing under the general modalities everywhere, the modality block, but they shouldn't be mixed. They should have their separate location. Alternating symptoms are interesting and important because they show you the dynamic of the patient. And alternating is mostly something that happens between a deeper state of pathology and a more superficial state of pathology. And therefore the alternating symptoms can tell you a little bit more about the current state of the patient. Perhaps maybe even more so than the modalities themselves. Another set, and then the last one for this little video, the extending rubrics. Left extending to right, vertex extending crosswise, extending to forehead. Some other authors group these extending rubrics under locations. But because it's an extension, it again shows a little bit more the dynamic aspects of the patient, of the case, like the alternating symptoms. And therefore, I think it's important to give them their own specific status as extending rubrics. Building blocks in themselves are used often, especially the larger ones, to cross rubrics, and by crossing come to a complete rubric, or if you wish, a rubric based on a complete symptom that can be used very well, Berningshausen style repertorization and analysis in the repertory. But that connects us to another video that I have made already, which you are welcome to view. Thank you. I have some things to correct. Take care.
Complete Dynamics is the most popular, and most widely used, #1 homeopathic software in the world. It is also included in the syllabus of UG and PG courses in several universities. Let us hear from the CEO and developer of Complete Dynamics software, Dr.Eduard himself. Over to you, Edward.
Now that you have covered the basics of creating an analysis and interpreting the results, it is time for some advanced topics that allow you to fine-tune the analysis in accordance with your interpretation of the patient's information. The topics we'll cover are using weights, balancing symptoms, polar rubrics and contraindications, rubric groups, rubric overview, and filtering the results on remedy families. Many actions can be performed on multiple selected lines at once. To select a single line, just click on it with the mouse. To select a range of lines, click on the first line, hold the Shift key, and click on the last line. To change the selection of a single line, hold down the Control key on the Windows or Command key on the Mac and click on the line. Every symptom and every rubric can be assigned a given weight. Just like you assign a certain importance to a patient's symptoms, or just like a remedy in the repertory can occur with different grades, you can assign a certain importance to each of the symptoms and rubrics. By assigning a higher value, the symptom or the rubric is counted with more importance in the analysis result. And by assigning a weight of 0, the symptom or rubric is excluded from the analysis completely. To set the weight, first select a symptom by clicking on it with the mouse. Now there are several ways to set the weight. Simply press any of the keyboard keys 0, 1, 2, 3 or 4. Or select one of the toolbar buttons. Or from the menu with menu case, weight, this example shows a case, an analysis in which weights are set. This is just for demonstration, it is not a realistic case example. You see the toolbar buttons on the left. The toolbar button always show the actual weight value of the given selected symptom or rubric. The X before a symptom or rubric indicates a weight of 0. It is excluded from the analysis. Balancing of symptoms is an advanced analysis mechanism compensating the use of many or few rubrics in a symptom. When balancing is switched on, which it normally is, you can place as many rubrics under a symptom as you want without disturbing the analysis. In traditional analysis, you would have to carefully select rubrics in an analysis, because if you would use too many rubrics to express a certain symptom, the remedies matching that single symptom would start to dominate the analysis. Likewise, if you would use only a single rubric, the remedies in that rubric would not sufficiently contribute to the overall analysis compared to rubrics used for the other symptoms. With balancing of symptoms switched on, every symptom is counted with the weight assigned to it, no matter whether you place a single rubric under it or let's say 10 rubrics. Balancing symptoms is switched on/off with the toolbar button, found on the right side of the window, or with menu Analysis Balance Symptoms. Let's take a look at this example. In this analysis, many rubrics are used to express the head pains. If no balancing is used, glonowin dominates the result, whereas with balancing, natriureticum becomes more apparent. Please note that balancing symptoms has no effect on the basic analysis simple counting. Polar rubrics are two rubrics which have an opposite meaning. As an example, let's take a look at a simple case in which initially remedy coffea was prescribed. Under generalities, we see two rubrics that both have a polar rubric: amelioration, aggravation; desires, aversion. It is possible to use these polar rubrics in the analysis by pressing the toolbar button, found at the right side of the window, or with menu Analysis Polar Rubrics. Now, under both rubric ML and desires, their polar rubrics are shown. The result of the analysis is also changed because the values of remedies are now corrected with the values in the polar rubrics. Remedy coffea is now colored red, because in this analysis it is contraindicated. A contraindication is a situation in which a remedy occurs in one rubric in a low grade, grade 1 or 2, or does not occur at all, but in the polar rubric in a high grade, 3 or 4. A more complex example is shown in the next Bunninghausen style analysis. Grouping of rubrics is done when you want two or more rubrics to count as if they were together a single rubrics. There are two ways of grouping rubrics: crossing, only remedies that occur in all rubrics are used, or combining, remedies from any of the rubrics are used. Some examples of grouping. Crossing of rubrics can be useful when there is no rubric in the repertory that exactly describes a patient's symptom, but only more generic rubrics. For example, the patient tells that during fever he has anxiety in bed in the morning. The repertory does not have a rubric mind, anxiety, morning, in bed during fever. But instead of this, there are two more generic rubrics: mind, anxiety, morning, in bed, and mind, anxiety, fever, during. By crossing these two rubrics, a new grouped rubric is created containing only the remedies that occur in both rubrics. Combining rubrics can be used when the patient has a symptom that is not found exactly, but can be found under more specific symptoms. For example, a desire for pizza. Why is it that the patient likes pizza? Maybe it is the dough, farinaceous food, tomatoes, salami, anchovies, cheese or olives. It can be useful to combine a number of such specific rubrics into a new rubric without disturbing the analysis formulas by adding lots of specific rubrics that don't really matter in comparison to the patient's chief complaints. Creating rubric groups. An example, a case with stitching, head pains while walking and fear of several kinds of animals. We want to cross the two rubrics that together describe the head pain. Select rubric Head Pain Stitching by clicking on it and press the toolbar button Group with other rubrics. A dialog pops up in which you can select the rubrics that can be linked with the selected rubric. Select rubric Generalities Walk and press the OK button. For the second group, we will choose another method. First we select the three rubrics Mind, Fear and press the button once more. Now we select option Combine and press the OK button. The resulting rubric list now shows a combined rubrics and crossed rubrics. To change a group, simply click on the group's main rubric and press the button. In the dialog, toggle rubrics on and off by clicking on them. You can also remove a rubric from a group by clicking on it and pressing this button, Remove Grouping. To remove a group completely, click on the combined group and click How rubric groups are used in an analysis. When crossing multiple rubrics, the group contains only those remedies that occur in all the rubrics in that group. The remedy grade will be the lowest grade of the remedy in all the rubrics. When combining multiple rubrics, the group contains remedies that occur in any of the rubrics in the group. The remedy grade will be the highest grade found for the remedy in any rubric in the group. Sometimes it is convenient to get an overview of all rubrics in an analysis together with their remedies. Also in case of grouped rubrics, you might want to see which remedies occur in the resulting group. To get an overview of all rubrics, just choose Menu, Case, Show Rubric Overview. The Find module opens showing the following: combined rubrics, the individual rubrics with the remedies, etc. By means of a filter, you can restrict the contents of the repertory to elements that you have special interest in.
In the current version, filtering is limited to selecting a group of remedies. Coming versions will offer you much more powerful filtering options. For this reason, the current documentation is kept limited. In the Book module, an extra option is available in the toolbar, by which you can select a group of remedies. A number of frequently used groups are predefined: minerals, plants, animals, nosodes. To choose another group, simply select option Other, and a dialog will appear in which you can select one of the groups in the Kingdoms and Families section. Use the filter option to quickly find the right remedy group. There are many situations where one or more remedies are shown. In several of those situations, it would be interesting to see which other remedies are considered important in the same situation. Differential diagnosis is a tool to show these alternatives. Differential diagnosis is available in the following modules. Find module, to show you other remedies of a rubric besides any remedies that you have searched for. Materia Medica module, for every symptom, shows you important other remedies that are known for this symptom too. Differential diagnosis is activated by pressing the light bulb button in the toolbar where available. Using menu option Menu View Remedies, show DD remedies. As an example, let's take a look at the reverse Materia Medica results for remedy arnica. After pressing the light bulb toolbar button in the toolbar, several additional remedies are shown for the symptoms. For example, for every symptom, at most 7 alternative remedies are shown. In the example, you will see that sometimes you see 7 remedies, but sometimes less. This is because remedies of a certain grade are only shown if all of them can be shown. So if you see remedies of grade 4 and grade 3, this means that there are no other remedies in that rubric with grade 4 or 3, but there might be remedies with grade 2 or 1 that are not shown. If you see no remedies at all, the rubric probably contains 8 or more remedies of the same importance, or there are no alternatives available at all. In the Find module, differential diagnosis also shows a list of relevant remedies for all rubrics that are found, similar to an analysis. In this example, after looking for 4 p.m.,
Now, moving on to our next expert, Professor Dr. Nambison. He will discuss about COVID-like illness, workup strategies and tools. Over to you, Nisanth.
So come let us jump on to the topic right away. As you already know that the COVID-like symptoms are found in most of the respiratory illness, and if you look at the WHO website, you will come to know that they have listed the most common, less common and the serious symptoms of COVID. You can also do a Google search to see what are the most common symptoms of corona. Here you can see that fever, dry cough and tiredness, these are the three symptoms. And if we want to directly do a repertorization from here, so you can copy it and then paste it into complete dynamics to see what are the symptoms that appear in the repertory. So now if we filter it to a more appropriate symptom of fever, and then go to the analysis tab to see the repertorization chart. So let us once again go back to the search result and then copy the second most common symptom and paste it into complete dynamics. So here you can choose most appropriate symptom in the cough chapter, dry, and add it into the analysis tab. Here you can see some more symptoms coming up in the analysis tab, and now let us copy the third most common symptom into complete dynamic search, and you can see that tiredness as a rubric doesn't come up in the result. So let us try tired in generalities, and you can see here tired is a rubric which has two cross references, lassitude and weariness. So let us choose this weariness as and add it into the analysis tab, and also choose lassitude and add it into the analysis. Now let us also try to search weakness as a alternative rubric for tiredness. So here we are trying to search it in the generalities chapter. Instead of choosing it from the whole of the repertory, let us choose it just from the chapter generalities. On the next page, let us select weakness and add it into the analysis tab to see all the three main common symptoms of corona infection. And here you can see lassitude, weakness and weariness. These are the three symptoms. If we switch off lassitude and weariness, you will see that arsenic is the remedy. Likewise, if we switch off weakness and keep lassitude in the analysis, then we will see that the remedy that comes up is phosphorus. And after that, if we switch off lassitude and weakness and keep weariness as the rubric in the analysis, you can see that the sulfur is the remedy. So as you already know that a medicine that is doing rounds in the media as a preventive medicine for this COVID-like illness is arsenicum album, and if you choose weakness as one of the symptoms of COVID, arsenic comes up in the repertorization table as number one remedy. So moving forward, let us also choose some clinical rubrics that can be found under epidemic. So here you can see that influenza is one of the COVID-like illness, and there are some remedies for influenza epidemic, and also there is a rubric influenza prophylactic. Let us choose both of them and see if in the analysis tab something comes up. So here you can see If we choose these clinical rubrics, phosphorus is the number one remedy that comes up. But as far as influenza prophylactic is concerned, arsenicum album is the remedy given in the Repertory, also Nux vomica and other remedies. Now let us move on to some other moderate to severe symptoms of COVID-like illness. So let us search for constriction of chest. So here in the chest chapter you can see constriction, and let us add this in the analysis, and here it is added. Now let us move on to another symptom, that is, so another severe symptom of chest is pneumonia. So let us search for pneumonia. You don't have to write the whole word, just pneumonia and influenza. You can reach the important rubric, and if you look at this rubric you will see there is influenza in or after. So let us add this rubric to analysis. Here we have added this rubric, and you can see that phosphorus comes up as a first remedy. Now let us search if you have any symptom of epidemic in the chest chapter. So you can see that you have three rubric here: inflammation epidemic lungs, and inflammation of bronchial tubes. So let us add this to the analysis. Another symptom of emergency is coldness of extremities due to shock. So if we try to find it in generalities chapter, because it affects the body as a whole, you can see that you have a rubric here: coldness, shock in. So let us add this rubric to the analysis, and you can see that there is a remedy camphora. Let us now see who has recommended this remedy. So after double clicking you will see that Lepe has recommended this remedy in 1915. So this is a fantastic tool to see and cross verify as to from which book and author this remedy has come. So this tool is very handy, and you should use this tool very often to see and recheck it in the Materia Medica. Other common presentation of COVID and COVID-like illness is generalized body pain. So in generalities chapter you can find pain. So here in the pain you can find this, and you can select this and add this rubric into the analysis. So language should not become a barrier for you to repertorize in your own language, and for this you can use a tool, that is phonetic input tool, that you can find online, and also you can install it onto your computer and then use it for repertorizing in your own language. So here you can see that if we do a repertorization using Hindi language, and if you search for respiration Kathin, so you don't have a appropriate rubric for that. So you can also search for respiration mushkil, that is difficulty in respiration. So here you can find that you have used two different languages to reach to important rubric that you want to use in the case. Another important symptom, that is a loss of smell, can be searched using a single language, that is gandh kam. So here you can see you have diminished smell, or you can have loss of wanting smell. So whichever you want to choose as per the case. So here let us choose loss of wanting smell. In the same way, you have another symptom, a common symptom in COVID, that is loss of taste. So for that, let us use a single language, that is Hindi. Swad mein kami, diminished taste and diminished smell. So this can also be used as per your case, because this is a very common symptom these days in COVID-like illness, in COVID and COVID-like illness. So here you can see, and you can add the rubric into the analysis. We cannot leave out fever in COVID-like illness, so let us search for fever and chills that are a common occurrence in almost all kind of respiratory illness. So here you can find fever and chill. So let us add this rubric to analysis. Let us add another common rubric, that is vomiting with pneumonia. So you can find that in stomach chapter, vomiting, pneumonia in, and we will add this into analysis. Let us first normalize this analysis as taught by Dr.Eduard, and then we have to go to an important rubric that is encountered in pandemics and epidemics, that is the fear in people. So fear epidemic brings up these rubrics, and one of the important rubric to be considered is fear diseases of contagious infectious. So here you can see, after adding this rubric, phosphorus is the first remedy, arsenic being second, entimtard being third, and you can see followed by pulsatilla, and then the fifth remedy is bryonia. Here in this repertorization table you can see that there are several similar rubrics that are adding up marks to push certain remedies to the front. So to do away with this erroneous calculation, you can use another important tool for balancing of symptoms. For balancing, we have to categorize these rubrics into their respective categories. So after adding rubrics to the analysis table, let us categorize these into specific symptoms. Now add a specific category like mind, and then you can categorize the symptoms of mind and put it into the mind category. Add another symptom, another category, nose, and put the symptoms and rubrics of nose into this category. Similarly, you can put a category named gastrointestinal tract, that is GIT, and add this rubric into GIT. After grouping them, the software will recalculate and balance the marks to show you the correct remedy. So you don't have to do it manually, which takes lot of time and effort. This is an advanced tool that is not to be found in other softwares. Now here finally, after balancing of symptoms, you can see that arsenic has come up as the first remedy, followed by ipecac and entimtard, and phosphorus has been pushed back to the fifth place. If you switch off this balancing symptom tool, then you will see that phosphorus has come back, and if you switch it on, you can see arsenic has come back as the first remedy. This is the beauty and power of this tool. Yet another advanced tool that we want to use is increasing the importance of rubric according to the case presentation. So here you can choose a rubric and then increase the importance of that rubric by choosing the number 4, 3, 2, 1 or 0. So here in this case, after increasing the rubric importance of weakness, dry cough and fever, you can see that arsenic is the remedy that has come up. Now there is a different view that we can see, that is different repertorial charts. Here you can see if small remedies were chosen amongst the repertorial result, you will see that natrum sulph is the remedy. Whereas if small rubrics were chosen, ipecac would have come as the remedy. And if Boning-Hessens method was used, arsenic would have been the remedy. Or if simple counting of remedy gradation was used, phosphorus would have come as the remedy. Now to use another detailed and advanced analysis tool, let us double click or let us right click the rubric and choose show repertory structure. So when you go into this structure, you can see a tree view where all the related rubrics to this general fever heat rubric are shown here. So if you double click any of these tree components, you will further refine your search, and you can double click any of them and go and see the detailed relationship of that particular rubric in that particular chapter. So here coldness, lack of heat can be related to sora, reaction lack of, vitality decreased, warmth desires. So these are some important rubrics that you can choose from these tree view, which is a very advanced technique not found in other softwares, which gives you a very important analysis tool which is very powerful, and you can go into the details of the case and look at it from a very different perspective. So here in this example, let us see loss of smell. So loss of smell, if you go into the tree view, here you can see loss of smell wanting. So that can be related to nose polyp, or it can be because of acuteness of the smell or oversensitiveness of the smell. Here you can see that this nose rubric is related to several mind related rubrics, and you can either choose a new rubric from this table and replace your existing rubric when you start refining it, and you see that the odor, the smell that is wanting is because of some other reason. Once again, this advanced tool helps you in cross questioning your patients. For example, if you go and want to get the details of dry cough, and you go into the rubric and then you see the repertory structure, you can see here if the dry cough is hard, hollow, and it is expectoration is absent or scanty, or it is in the generalities chapter. So here you can double click hollow and see what are the related rubrics: deep sounding, general cough, or dry hollow cough. So these are some important techniques that you can use to reconfirm your symptom from the patient, or if you want to recheck whether the correct rubric has been chosen for repertorization. So here you can go into the rubric and you can see the remedies and verify the author who has recommended that remedy. For doing a visual analysis, you can change the look and do a visual analysis back and forth. So finally, after doing such quick repertorization, don't forget to save the case at appropriate place. So go to the case and then choose a name, and then when you click OK, the case is automatically saved in your database. Repertory and repertorization has come a long way, and you can use these advanced features in your mobile device too. Now your clinic is in your pocket. Now anywhere, open up the complete dynamic software and start typing the symptoms of your patient, in this case fever and cough, and it will bring up the rubrics in the repertory. After you find an appropriate rubric for your patient, you can then long press the remedy or rubric to bring up the menu. In this case, let us long press the medicine and go to Materia Medica quick view. Here you can see the remedy relationship and the red line symptoms and the Borix Materia Medica. So here you can verify the medicine and its symptoms, is it matching to your patients or not, and then come back to the rubric again. To add the rubric to the analysis, long press the rubric and select it so that the rubric is added to the analysis, and here you can see it has been added to the analysis. Now you can also look at it with various views. Now to see the Materia Medica, you can choose Materia Medica and then the remedy name, and then you can also watch and read the different Materia Medicas and the symptoms of any remedies that you want to check. If you don't want to type, or if you make mistakes in typing, you can use the artificial intelligence provided in the Android phone to do the repertorization without typing. To choose the language of your speech, you can change the settings of your keyboard, and then you can press the mic on your keyboard to speak.
Shararat.
This tool and artificial intelligence is very important for people who have a tough time in finding difficult rubrics. Here, a very common rubric in the children's Shararat is used, mischief. So here you can reach the rubric with a great amount of ease. Let us now try this for a very common symptom of COVID and COVID-like illness.
Bukhar, Khasi.
As you can see that with such an ease, by speaking it in your own language, the appropriate COVID-like symptom has come up in the repertory. Now you can repertorize this case. So I don't think repertorization could have been easier than this.
Avsar.
So everybody is comfortable in repertorizing in his or her language. So here a very common symptom of SAD, depression, and several other difficult mind rubrics can be searched with very ease, and this tool of artificial intelligence has proved to be a boon to homeopathy and homeopaths. So I hope today you learned a lot of new techniques, new repertorization techniques, the tools that you can use to overcome your limitations to repertorize. And today we had this very important focus that we don't give you the remedy right away, that what is the remedy that you have to use for COVID-like illness or any other case for that matter, but we wanted to give you the strategies and the tools that you can use and arrive at the right simillimum, because every COVID patient has a different set of symptoms and you have to treat them accordingly. So I hope this webinar helped you, and thank you very much for attending this webinar, taking time out of your busy practice, busy schedule. So thank you very much. Be safe and be healthy.
Those who want the course certificate, please complete the formality, and we will send the certificate to your registered email ID. Stay safe and keep learning.